Hi, everyone. Thanks for joining our webinar. I'm going to wait just a couple of more seconds for people to come online, and then we'll get started. All right, thanks again for joining today's webinar, How Forms Processes Can Improve ASC Patient Care. Before we get started, I wanted to go over a couple of housekeeping items. This webinar is being recorded, and it'll be distributed via email to everyone who registered. All participants will be muted to minimize disruptions during the presentation, but please join in on the conversation throughout by using GoToWebinar questions or the Q&A section. We'll go through those at the end, but you're welcome to submit questions throughout. We'll also do a couple of polls today. My name's Desiree Paoli. I'm the Director of Product Marketing at Interlace Health, where I'm responsible for solving common workflow challenges for our healthcare customers. And again, I'm grateful that you've joined me today. So quick agenda of what we're going to be talking about during our time. First, we're going to understand how a digital forms on demand process saves time and enhances information exchange. Second, we're going to learn how automated printing reduces time and finding the right forms that you need at registration. And then finally, we'll talk through the value of a forms committee and a digital forms library. So let's jump right in. There are three big reasons why you should be looking to prioritize digital forms at your organization this year. First, critical staff shortages across all industries are really making leadership pause and think about how can we make things easier for the staff that remain. Staff and patients have been wanting a more digital experience in healthcare for a long time, and they are having higher expectations of us satisfying those needs now more than ever before. And so it is where healthcare is heading. The pandemic has forced telehealth to move to the front of a patient's experience, and they want all of those other digital technologies that go along with that. So I want to talk a little bit about the Great Resignation. I know some people are getting tired of hearing about this, but I really do think it impacts why digital forms can be so beneficial to your organization. Healthcare jobs have always been stressful, and of course the pandemic has made that more so. People are struggling with so many things. So it's no wonder that 18% of healthcare workers have quit their jobs during the pandemic, and another 31% have considered leaving. On top of that, 12% have been laid off. So busy organizations are really feeling the strain of these staff shortages. Becker's shared that in September 21 alone, the healthcare industry had 589,000 quits. That is a huge percentage, leaving so many people carrying the burden for multiple people. And the ASC space is feeling that pain as well. 77% of ASCs surveyed said they are experiencing staff shortages. And all of them listed staff shortages as the #1 concern of leadership this year. We know you all are struggling. So now let's talk about the impact of the status quo. So health system leaders I know take those statistics on the previous slide to heart. They know how dedicated healthcare workers are, and they understand the strain that those shortages of staff can cause for those who remain on the job. Many CIOs, health IT leaders, and ASC leadership teams have told us that their top priority is to find ways to reduce these strains by looking into new and improved processes for staff. And rightly so, because the impact spanned beyond staff burnout and patient satisfaction. Tedious paper-based tasks drain resources unnecessarily. Document errors and missing data cause compliance headaches at a minimum and lost revenue at the other end of the spectrum. Subpar workflows can create critical delays in care, such as surgical delays or reschedules when informed consents go missing. So let's look at a little bit more data about the struggle with paper. Wakefield Research recently released the Internet of Healthcare report, which uncovers how patients, healthcare professionals, administrative staff, and executives view the healthcare patient and employee experience. Half of the healthcare administrative staff report seeing an increase in the amount of manual data entry in the past 12 months, as if we're actually going backwards, away from some of the new digital technologies that have come out over the years. In fact, 54% of staff reported using paper-based forms at least once a day, but most were far more often. So it's no wonder that 92% of clinicians agreed that too much time spent on administrative tasks is cumbersome and that it's a major contributor to healthcare worker burnout. So why change now? We've talked a lot about why the paper-based workflows need to be eliminated, but I want to talk a little bit about why the time to do that is right now. First, these manual workflows just aren't sustainable anymore. As we've seen from the previous slides, they have a negative impact on your staff and your organizational process, and they are just draining unnecessary resources on your staff's time when, again, you're having staff shortages and they are really struggling to keep up with patient volumes and their own workload. Creating a digital forms library is really your very first step in moving patient data collection away from paper. By doing an organization-wide forms audit, you can reduce unnecessary forms, weed out those strenuous processes, and ensure only the most up-to-date, approved forms are accessible to all of your staff. We really are at a critical juncture. There were some key findings in that Internet of Healthcare report that I want to share, and they confirmed that clinical processes need to be updated urgently, not just to alleviate worker overload, but to deliver optimal care for patients. The report found that an average of 21% of patient records have at least one error. Imagine if that error was always something vital to payment, like date of birth or patient medication allergies or something like that. Quality outcomes and payment collection would both decrease. Interestingly, 48% of clinicians agree that paperwork will be eliminated in the next 5 years. So we really are at that critical juncture where it is time to start that process. And your staff need it to happen. 93% of healthcare professionals believe that applying automation to remedy these process burdens will be good for their careers because it allows them to focus on more important things. Many of administrative staff and leadership all agreed that employee turnover will be most likely consequence of their organization not automating in the next 1 to 2 years. And well over half of executives said that hiring is just no longer enough to solve the process problems and handle the volume of paper and data coming through being managed for their patients. We've got to automate some of the process. And then finally, lots of stats on this slide, but 91% of healthcare professionals agree that fixing the burden of time-intensive manual administrative processes is the most important thing they can do to improve the quality of patient care. So again, the healthcare industry has transformed dramatically over the last 2 years, but they're still behind other industries. Healthcare workers deserve the automation that so many other industries have, allowing them to function at their very best for their patients. It has been too long that staff are spending their time on mundane administrative tasks, like collecting the same patient information on paper again and again. It's clear that everyone wants to run towards change, and the benefits are vast. And so this is why the time for digital forms is now. So I want to do a poll quickly and talk through whether or not you're using digital forms today outside of your practice management system or EHR if you're on one. So you're going to see a poll pop up and you can just quickly check yes or no. And I will wait for a good chunk of the responses to come in, just a few more seconds, and then we will move on with the presentation. For those of you already entering your answer, I appreciate that. Give it about 10 more seconds here. All right. Thank you all. It looks like it's about a 70-30 split with 30% of ASC people on the call using forms today digitally, and the rest using them on paper, or perhaps they're using them through their practice management system or EHR. Thanks again for doing that. All right, so now I want to talk a little bit about the benefits of starting the transition to digital, but maybe still using printing if that's the best workflow for your organization and for your staff. So if you are still printing, let's talk about how we can make that a little bit easier for you. So we all know that paper is a major headache. And oftentimes nurses get stuck with the bulk of that paperwork, especially when it's requiring patient signature prior to procedures or during their appointments. And nurses are driven to treat patients and to help them get better. They are not driven to spend time on paperwork. But again, that's exactly what can happen with outmoded processes. And we saw that on some of the other slides, spending a significant amount of their time pushing paper through the system. So here's how one nurse who I spoke with, who does not work for one of our clients, described the forms process at their organization. She said, we all have to decide for ourselves which form a patient needs and put it into the file. But what happens with it after that falls on that of the individual team or particular surgical center to decide. It might be, oh, I put it in Mary's basket and then every Thursday she scans it in and files them away. And that's the process at one location. But in another location, maybe they scan them in immediately and then they get emailed to someone who reviews and then puts them away digitally. But when they're short-staffed, she says, we might all work in different locations, different departments every day, and it's a major headache to remember all of these different processes. So then, what happens if a form can't be located? We asked her, and she said it's not just a waste of time, but then we have to go back to the patient and ask them to fill it out again, when we already have all that information in our system, but we just need that physical form signed. So as I've shared before, leadership understands the strain that comes with working in an environment where you're carrying the weight of 3 people by yourself. And so improving forms automation can't really relieve all the stress healthcare workers are facing, but it can alleviate just a little bit of that pressure with the day-to-day tedious tasks. So if you are still printing, how can we make it better? So when you use our Forms on Demand solution, which I'll continue talking about in the coming slides a little bit more, you're creating a digital library of all of your forms. We're helping you convert all of those to digital and store them in one location, a web-based browser, where anyone in your team can access them. And then we can set it up so that those forms are automatically generated when your patient schedules an appointment. So you're not scrambling to find the right form when they come in or a few hours before their appointment. It's all happening automatically, directly from your practice management system into our solution and pulling up the forms and assigning them. It's a standardized workflow that everyone across all your locations would be using. There's minimal prep because all of the patient demographics information auto-populates on those forms and prints out when you need them. So you are still printing, but you're not printing and having to have the patient handwrite in information that they know that you already have. It's taking just a little bit of that work out, especially if all you're needing to collect from them is a signature. And then we can also print barcodes so that you can quickly scan those back and file to a specific location, either in your practice management system, your EHR, or even just on your server if that's what you choose. So while you are still printing, it really just cleans up the process, takes out a lot of the manual pieces, and makes it easier for both your patients and your staff. It's easy to forget how important forms are because everybody's got them, right? And it's easy to just print out a stack, you grab one, you hand it to the patient, and you move on. But when you dig into how much time you're spending on each one of those forms and how critical the information on those forms is to your organization, you really can start to see how important it is to make change there. We know that forms help you collect that most critical patient data, whether it's at registration or on an informed consent prior to your surgeries. Those forms are important. And so it's important to focus on that process that you have and make sure that it's as efficient as it can be. Forms are some of the easiest process issues to fix, but often the most overlooked when it comes to new technologies. Like I said, old habits die hard and people get stuck in those old ways. But the impacts on your staff and those day-to-day tasks that they have to do is invaluable. You're allowing digital automation to carry some of that burden for them and make things just a little bit easier. And forms optimization never really goes away. It's something that you'll always need to focus on and ensure that those processes are going smoothly and efficiently. And having everything in a digital library really allows you to do those audits of your forms more quickly, review what's being used in what locations, and make better decisions about how you can move forward with continued improvements related to that data collection. But I know many organizations struggle with making big changes in process and administrative technologies. So I want to ask another quick poll question and see, and I only have a few answers in here, and I know there could be many more, but of this list that I'm sharing here on the screen, what is your organization's biggest resistance to process change? And give me just 2 seconds here to get it to launch. So you should now be seeing that on the screen, and there's a few answers that, first of all, maybe it's just that it is a new process and that sort of fear of change. They don't want to do something different. That could be the reason. Second, it's the cost to buy or implement new technologies. Or is it the staff time? You know, maybe the cost isn't as much as the issue as your IT resources or your leadership resources are so bogged down with other projects right now that you can't focus the time on that. And then finally, I put in other just in case you do have something else in there that's really your biggest resistance to change. So it looks like I've got a good chunk of them coming in, and it's pretty split across. So I appreciate you taking the time to answer that question. I'm going to close this here, and we will move on. So how can we help here at Interlace? We really work to let the technology do some of that work for you. So Interlace Health offers your staff a simple and streamlined way to access and print forms on demand from a browser anywhere in your organization. Whether you need to find forms for registration, clinical, informed consent process, you can really access whatever you need and whatever you've plugged into the Forms on Demand solution. It's that digital library of only the most up-to-date approved forms. This reduces labor associated with finding and labeling forms and eliminates the cost of printing and shredding all of those stacks of outdated forms because you're really only printing what you need when you need it. And then improving compliance. Because these forms are the most up-to-date, they're scan ready, so you've got error-free indexing backend. And for those informed consents, they're time and date stamped, and those signatures are locked in, so they can't be edited later. So you're really ensuring that the forms that you're collecting meet all of the requirements and are the quality forms that you're hoping to collect with your patients. It really is a simple change. We know everyone's focused on making their existing systems, whether that's your practice management system, your EHR, work harder and more efficiently than ever before, but digital forms libraries are an easy way to do that. You can streamline data utilization by taking that data that's already there for your patients in your practice management system and using it in a more automated and impactful way. And that one example is to use API or HL7 integrations, simple technology that's been around for a while, to pull data from a patient's record and autofill it into your forms that are traditionally completed with pen and paper. This integration is often the easiest and most overlooked way to streamline data utilization. But auto-populating that data instead of manually entering it, as I've shared today, saves a significant amount of time and money. And then on the last point here, one source of truth. What looks like a forms problem in your organization is more likely a process issue. So improving the form itself without addressing staff workflows, patient interaction, and data exchange won't always solve those issues and may keep your organization from achieving your objectives. So the Digital Forms Library offers you a simple and streamlined way to access and print those forms from any browser anywhere in the organization. So like I said before, whether you need them at registration, for clinical documentation, informed consent, our solution really provides you that quick way to access, print, or even electronically sign those forms if that's the workflow that works best for you. So if you remember one slide today, I want to talk about measuring the value. I hope that it is this one, that you remember that this is the value you can present up to your leadership by converting over to digital forms. You can save time for both your staff and those patients. It reduces all the printing and scanning and shredding costs of unnecessary forms that are being stored in your facility. And really, it creates a standardized process at all of your areas where you're collecting those forms. So everyone can feel confident knowing that they know the process and they've got the most up-to-date form. So final poll question here of the day is, would you like to learn more about our Forms on Demand solution and get a free ROI assessment? So I've popped that up on the screen there, and you can quickly click yes or no. Leave it up for just a few more seconds here. Thanks for taking the time to do that. And we are going to wrap up today. This is a quick webinar. I really appreciate you all joining us. I'm going to open it up to questions in just a moment. But where can you see us next? So if you want to see a more thorough demo of our Forms on Demand solution, that'll be happening on June 1st at 11 a.m. Central. And you can register for that by going to our website, interlacehealth.com/resources, and you'll be able to register for any of our upcoming webinars or these live demos. We'll have another webinar later on in the month, so next week, how Forms on Demand relieves paper overload at one Canadian hospital. I'll be talking with someone from that location about how they've implemented Forms on Demand. And then if you happen to be at Muse Inspire in Dallas next week, we will be there, booth 320 in the exhibit hall. And again, anytime you can reach out to us to learn more about our solution and get a customized demo and ROI analysis. Simply go to interlacehealth.com. So I'm going to open it up for questions now, and it looks like we just have a couple that have come through. And the first one we get often, and I always enjoy it, and whether or not our solution works on specific practice management systems or only specific EHRs. And the answer to that is that we are EHR and practice management system agnostic. As long as we can get that API or HL7 data integration from you, we can make your solution work with ours. Thanks for that question. All right, I have another question in here about printing blank forms. It says, do we always have to auto-populate the forms with patient data, or can we print out blank forms when we need them? You can absolutely print out blank forms as well, if that is what you need, which we understand sometimes you maybe haven't had the chance to go and assign that form to the particular patient and you just need to print something blank out, and that is totally doable as well. So thanks for that question. And then it says here, can you also collect signatures on the forms, or do you have to print them out and have the patient sign them and scan them back in with the barcode? So we can also do e-signature. I focused today on the digital forms library and the automated or on-demand printing piece, but we also have an e-signature solution where you can fully digitize those forms, have that forms library, assign the form to the patient can quickly fill out the form and sign, either using a Topaz device or a mobile device that you might have in the office, or in some cases, a registration, even their own device that they can complete the forms and sign them from home. And like I said earlier, that does time and date stamp those signatures and lock it in. And we can also do counter signatures. So especially in the case of informed consent, where the physician also needs to sign that document, we have an unlimited number of signatures that can plug in there after the patient has signed. And again, that will archive digitally and will be locked so that nobody can edit that, and you can always go in and access it. All right, I think that was our last question. I appreciate you all joining us again today as we talked about Forms on Demand in the ASC space. Again, please reach out with any questions at all at interlacehealth.com/contact. And thank you for your time today.